Hi there. This is Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. As you know, this is where we discuss important health-related topics that matters to everyone. And previously, we were talking about hypertension, a silent killer. Hypertension is something that can affect anyone at any time. So do well to check our previous video and you would learn something about hypertension. My name is Amazing Rita, I'm your host, and with me in the studio is Dr. Timba Favor. Hi, Dr. Favor.
Hello.
All right, so today we are still continuing on our topic on hypertension. Remember, we told you last week that we still have a lot of questions to ask and a lot of things we want to know about hypertension, but we're not able to conclude it all in our previous episode. So this is us continuing this topic, hypertension, the silent killer. So previously we learned about what hypertension is, the range or the measurement of hypertension. We learned that we have the normal blood pressure, we have the pre-hypertension, right? We have the stage 1, the stage 2, and also the hypertensive stage. And we also
Hypertensive crisis.
Yes, hypertensive crisis, thank you. We also learned that some people can be in this pre-hypertensive crisis stage and not show any signs. We also learned that hypertensive can be in the urgency stage and also the emergency stage. So please, that video or that episode is packed with a lot of information. So go and check it out. And we are continuing today because I want to also know, Dr. Favor, is hypertension, since we've established that it's a silent killer because it sometimes just happens without people not knowing that they are even hypertensive. Maybe the first time they're getting to know that they're hypertensive is when the person has collapsed, or maybe they did autopsy or whatsoever, and then you realize or check, you realize that the person died out of hypertension. Now, is it manageable? Can it be prevented? Can you even cure it? And you know that, okay, this person is no longer hypertensive.
Okay, this question does not have a definite answer. Yeah, but then based on the cause of this person's hypertension, if it's something that is genetic, remember I told you for the genetic causes, it could be that there's a genetic alteration. So for that one, you know it would have no cure. Yes. But then for some other causes, like let me say obesity.
Yes.
You know, if this person's hypertension is secondary to obesity, if the person works on his or her weight, healthy weight, it's possible that it could be cured.
Okay.
Yes, but like I said, it does not have a definite answer. Exactly. So it's based on the cause actually. For genetic, that one is just there. You can't cure it. But for like now someone whose risk factor is chronic alcoholism and smoking, yes. If it has not gotten so far, I believe to an extent you can do something about it, like you can cure it.
Okay, so for someone who is living or who is hypertensive, and you talked about intake of salt being one of the risk factors. So will that person be taking more water or less water? Would that person try to consider the amount of water they take daily, not just water, and how strenuous their day is? Or should I say exercise they get themselves into? Because you also said that if the person can manage their weight, they can get cured of the hypertension. So if the person is already having hypertension, would you advise the person to exercise more, drink more water, or exercise less, drink less water?
Okay, definitely it would be to exercise more and drink more water.
More water.
Because like I said, someone that is hypertensive, there are some organs that are at risk. Because like I said, some organs, when it gets to hypertensive crisis, some particular organs are the target organs. So the person will obviously have to drink more water because water is not just good generally, but it will also help the kidney, very important for the kidney. And then I know the person will be considering the fact that taking a lot of water, won't it like just like now I'm filling the balloon with more air. Yes, but then it depends on the medications this person is on. There's some medications that their mechanism of action is diuresis. Diuresis is like it will make the person urinate more. The only thing this person will be bothered about is that maybe if it's at night, he or she may wake up severally to go and ease himself or herself. Yes, but then those diuretics, that's the medications that help with urination, they could be taken in the morning so that you're not asleep in the morning, so you can easily ease yourself. So you can take those medications in the morning, and then more of exercise, definitely not less.
Okay, talking about medication, I think blood pressure medication is one of the drugs people abuse in Nigeria. Because we feel that, high blood pressure, I get the one where they drink, you too drink them. So is there like a general blood pressure medication, or the medications are prescribed based on the individual? Yeah,
exactly. Medications are prescribed based on the individual. Like this person could be having hypertension, this person having hypertension, and then this person trying to take the same medications this person is taking, it may not work for her or him. Yes. So it's always ideal you see your cardiologist. Even me as a doctor, I can't just see a patient who has had particular sets of medications working for him or her and then just change them like that. Yes. And then I can't just see a patient who has a particular cardiologist he or she works with, and then I just decide on my own without even consulting this cardiologist, yes, and just decide to change the medication for myself. No, it's not ideal. So like particular individuals have particular medications that suit their blood pressure.
Okay, how often should one check their blood pressure?
Okay, it depends. Like someone that is a chronic hypertensive, like you've been diagnosed so many years ago, you should check as often as possible, and then also be compliant with your medication. Then for someone who is just newly diagnosed, like I told you, the person's medications. First of all, for someone who is newly diagnosed, you don't just even start on medications. Yes, there's something they call DASH, dietary approach to stopping hypertension. Yes, it's the use of diet. So for that person, you could start the person on dietary modifications first. So with whatever you're doing, whatever you're implementing to help control this blood pressure, yes, it should actually go hand in hand with you checking to see if what you're doing is actually working. So you can check your blood pressure as often as possible.
But why is it advisable to check regularly? Even though you feel, or you say you feel fine.
You're well, yes. So like, when in our previous session, we said this person could present as symptomatic. You're just living your normal life. You remember the story I told you of a man who brought a patient to the hospital, and then a random nurse just told him, why not check your blood pressure? And then he had hypertensive urgency. So to him, he didn't even know. He hadn't any idea because he was fit. So that's why it's advisable, because like I said earlier, your body could start adapting to the rise in blood pressure, gradually adapting until it's time to strike. Do you understand? And by then the blood pressure is very high. So it's just advisable to be on the safe side. It won't take you anything. Just check your blood pressure.
Okay, so recently I have noticed that young people are at, I won't say higher risk, but it is now very common for you to see or hear that someone so young died of hypertension or is hypertensive. And most times it's always in the emergency, in an emergency situation. That's when the person finds out. Why is it that young people are having it right now? Frequently. Because back then, I don't know, but you would always hear parents say, people don't suffer, young people don't suffer hypertension. But now young people are suffering from hypertension. Why?
Okay, from my own observation, or what I think is this. You know, I told you diet is one of the risk factors. So if you check out now, a lot of young people want to eat processed things, want to eat saturated fatty things that contain saturated fats, want to eat the shawarma, the
Pizza.
suya. Yeah, so and you can see
Pizza with extra cheese.
exactly. I think you're a culprit.
No, I'm not. I am not.
Okay, then you see, like some young people now, they just want to sit at home and make quick money.
Yes.
So they're not really, they're living the sedentary life, which is a risk factor. So you see all these things come in play, and then most of them come down with hypertension.
Okay.
Yes, but the genetics as a risk factor
Yes.
affects more of older
Old
people.
Okay. Okay. So what daily lifestyle can we do, or things we can do to prevent hypertension?
Okay, just like I said earlier, just regular exercise. Yes, for people who are on the big side, like there are some exercises they won't really recommend for them. But to the best of my knowledge, you could cycle, you could take short walks, just light exercises that won't really affect the heart, especially for people who are on the big side. Then for those who take alcohol a lot, they have to cut down on it, because it's not just detrimental to the blood vessels, it can affect the liver, can as well affect the kidney. Those people who smoke, yeah, so they should cut down on it. Just adapting healthy lifestyles generally.
Okay.
Yeah.
So what happens? What then happens if hypertension is left untreated for a very long time?
Okay.
Maybe one, it could be due to the fact that the person does not even know that this is even hypertension.
Okay.
But before that,
Okay.
let me ask you some of the symptoms
Okay.
of somebody experiencing hypertension or having an hypertensive attack.
Okay.
What would be the symptoms they will see?
Okay. It could lead to things like headache. This person could be having severe headache, like person has gone to the hospital, gone to a chemist. You trust our people now. Patent drug dealers are their friends. They'll just go over the counter.
Over the counter.
Please mix serum
Pink
or
one.
mix
They always say that pink one.
Exactly. So they've treated and treated and treated, and then the headache is still there.
Yes.
But they've never considered checking their blood pressure, seeing a cardiologist. Some of them could present with fatigue. You're just very weak. And then remember, I said it could affect different systems. Yes, there are some target organs. So sometimes the person will just be very weak. It could also present as nosebleed. Exactly, like when the pressure is very high, the person will just be having nose bleeding, and then you won't even know why until you take your history, proper history. You discover it could be from the hypertension.
Okay.
Yeah.
So nosebleed, frequent headache, fatigue. What about dizziness?
You could also feel dizzy. Yeah, when your blood pressure is very elevated.
Okay. Can for somebody that is experiencing that symptom,
yeah,
what do you think they could do immediately to help themselves?
Which of the symptoms in particular?
Especially the dizziness and the headache, frequent headache.
Okay, it's obviously to see your healthcare provider, because you going to the chemist, like I told you, this person's medication would be peculiar from this person's own. The chemist may just have it in mind that maybe amlodipine is used to treat hypertension, and then this person is coming to him and telling him, I'm having serious headache, and maybe he's able to manage and say it's due to your high blood pressure. He could just give him this medication, and then it's not doing much for him. So advisably, just see your healthcare provider. Just go to a hospital. Yeah.
So is chest pain one of the symptoms?
I won't really say it's an exact or direct.
Say they're feeling a piercing pain.
Okay.
In their chest.
Where that comes from is for someone now who has a cardiac issue.
Okay.
Maybe Remember, people with cardiac issues are also at risk of hypertension.
Okay.
Yes, maybe a coronary artery disease, or the blood vessel maybe the pressure was too high, and then the blood vessel ruptured, and then blood supply to the muscles of the heart is now limited. The person could have a sharp pain, angina. but you won't really say that's a chest pain. It's just that we are used to calling it chest pain. You just point at the location and say, I'm having a chest pain, but you won't really call it a chest pain.
One other question I want to ask is,
Okay.
how would people around help somebody who is suffering from hypertension or is having an hypertensive attack right now? You know, example, when with someone who is diabetic, maybe type 1 or probably type 2 that's progressed, you would say, okay, inject the insulin. Or somebody who can't breathe or who is breathless, you say, okay, do CPR. Or somebody who is having an hypertensive attack and you are seeing it happen. Maybe you may not know it's hypertension, but the person is losing life just in front of. Is there something we can do to actually help the patient at that particular time?
At the moment?
At the moment.
Okay, you know, I told you, like now, someone having hypertensive urgency, what you will do for that person is different from someone having hypertensive emergency. So you may even tell yourself, maybe you're not a healthcare provider, you just tell yourself, oh, I know they use this medication for hypertension, and then maybe this person is having emergency, and then you're giving the oral medication. It won't really do anything. And then maybe you have an idea, maybe you've worked in a healthcare center and you know they use this injection for hypertension, and then this person is having urgency and you go to give the injection, it would crash that person's BP such that the person will start having end organ damage. So ideally, it's just to quickly rush the person to the hospital.
I've heard some people actually advise, give advice and say, okay, if someone who you know is hypertensive, is having a crisis or is having an attack, you make sure that they take their drug instantly. Is that right?
Obviously, like being consistent and compliant with your medication is a very wonderful practice. But before someone gets to that stage where like it's so serious, it's at that serious point, it could be that this person is already having a stroke, and that's why the person is presenting with what he or she is presenting with. The ideal thing at that point is to take this person to the hospital. Yes, because just giving that medication, you won't know if this is a hemorrhagic stroke and ischemic stroke. Like, there are different things, so you should not just administer at that point. Yes, but ideally, generally speaking, if you can support your partner, your friend, whoever that you know is a known hypertensive, what you can do for them is constantly remind them, have you had your medications today? Yes. Or you can set timings, maybe alarms to help them remember, I'm to take my medications at this point.
So, all right. Why is it that in the community today and in our various groups, hypertension is one thing that is mostly overlooked? They don't see it as, in as much as we know it's the silent, or we've established that it's a silent killer. It doesn't give a warning sign. But when people sensitize, or when people talk about things that are deadly, you hear something like HIV, like AIDS, you hear something like hepatitis, but they don't take hypertension very serious. Why?
The reason I can see is because if you're compliant with your medication, hypertension can be controlled properly, and you won't managed. All you need to do is be compliant with your medications, be compliant with your visits. But something like hepatitis B now, there's no cure yet for it. But hypertension, once you're doing the right thing, it can be under control. So I think that's a reason why people are not so scared, or they don't really dread it. Do you understand? And then you see patients who come to the hospital and they're like, I'm taking my medication today, I took my medication yesterday, and I feel I'm okay. So I don't need to continue taking my medications till when I just go to check my blood pressure and I see it's elevated, then I'll take my medication. But that's a wrong practice. Ideally, when your medications are given to you, you should comply with the instruction of the doctor. And if you feel there's a need for you to stop taking your medications, you must seek the consent of your healthcare provider before doing that. So I guess is the reason why people don't dread hypertension is because if you're compliant with your medication, it can be controlled, well controlled, yes.
So for a community that has old people, maybe like you say church or meetings, village meetings and the rest. How often should these people be sensitized about hypertension?
Okay, as often as possible, I guess. The reason is this: you maybe this in this gathering, you don't know if it's everyone that is in this gathering, and hearing it often is just like creating a reminder to tell you that this is what you should actually look into. Yes, so I don't think there should be a number of times to create awareness. As often as it can be done will be beautiful.
Tell us, as a doctor, practicing doctor for some time, what's that one thing you wish everyone knew about high blood pressure?
Okay, the one thing I wish everyone knew about hypertension is this: hypertension is a silent killer because it affects various organs. It can affect the brain, can affect the kidney, can affect the eyes, can affect the peripheral vessels. So it can affect various organs in the body. So the one thing I wish everyone knows is hypertension is a silent killer. If you're a known hypertensive, be compliant with your medications. Try to visit your healthcare provider often. Don't assume because you feel fit, so you can just stop your medications on your own. And then when it gets to a hypertensive crisis is when you now realize, I've made a mistake. Yes, so that's it.
That's it. Thank you so much, Dr.
You're
Favor.
welcome.
Thank you. And I like the fact that right now we understand that in as much as it's a silent killer, it's not a death sentence. If you can, if you know what is wrong with you, you can better manage it. How do you know what's wrong with you? You have to see a doctor. If your neighbor that is a nurse, or your neighbor that is a pharmacist, or your brother that is a lab tech, cannot do anything for you, or would not do as much good for you than a doctor. So whenever you're feeling any symptom, or whenever you're feeling anything in your body and you're not sure, it's always advisable to first see a doctor. Exactly. And then from there, your whatever the condition is can be managed properly. And hypertension is not something that you say, okay, this person is taking this drug, so I think since it's the same thing, since the doctor said it's the same thing, I can take this drug with this person. Maybe people will be sharing it. This one will take 2 in the morning, you take 2 in the afternoon. So do well to see a doctor. And in case you know someone who is hypertensive, you can share this video with them and tell them to come and see what we're talking about hypertension. Until we come your way again with another educating and exciting topic, something that matters to everyone. My name is Amazing Rita, and with me is
Dimba Favor.
Dr. Dimba Favor. And do not forget, today, in fact this week, whenever you watch this video, try to check your blood pressure. And we'll see you in our next video. Bye for now.
Bye.